Hi everyone, this is Christy Edwards. Thank you so much for joining us for the Flex Supplemental Funding Reporting and Evaluation Process webinar. Here with me is Sarah Young, the Flex Program Coordinator, and we also have Tracy Morton from TASC joining us today. So just a quick look at the agenda today. We're basically just going to sort of go through what's going on right now with the Flex Supplemental Awards, and then talk through what the reporting requirements and the evaluation are going to look like. So for a little bit of background, this is the language that was in the FY17 congressional budget legislation. It was passed on May 5th, and it included additional funds and instruction for the use of those funds with a focus on substance abuse. Substance abuse activities are new. We've never included them in the Flex program, but they are included for the supplement. The timeline for writing the proposals for the supplement was really short, but you all rose to the occasion with diverse proposals for all kinds of really great ways to solve problems with your CAW communities. So just a little brief talk about all the projects that have been selected. We're really excited about the range of projects that CAWs will be working on, and we were really impressed with all the creative solutions you guys came up with. We've not yet finalized all of the projects, so these numbers may change, but 14 CAWs are doing quality improvements, not only things like HCAHPS and EDTC, but also infection control, chronic care management, and readmissions. 8 CAWs are doing a financial and operational improvement projects, things like revenue cycle management, in-depth assessments, and lean training. And 21 CAWs are doing a substance abuse project. These fall broadly into a couple of categories: prevention, implementing new pain management policies, and community education, treatment, so training law enforcement and community members on the use of naloxone, implementing new policies in the emergency department for overdose patients, connecting overdose patients with longer-term treatment options, and telehealth for behavioral health and substance abuse treatment. There were projects involving nurses, doctors, other CAW staff, as well as law enforcement, EMS, behavioral health professionals, and community members. It's a diverse group of projects with participation from people across the spectrum of CAW and community stakeholders. So you may recognize this, this language. This is from your Flex Notices of Award. There are some reporting requirements for the supplemental funds. This is the language here. It's in your NOA. The reporting for the supplemental projects will be done outside of the normal process for Flex. So you don't have to report on your supplemental projects in PINS next year, which I'm sure you are all thrilled about. What is required is a mid-year and an end-of-year report turned into FORHP, as well as data submissions to TASC, which we will discuss in just a minute. So quickly, we're just going to sort of go through what the FORHP report is going to look like. As it says in your notice of award, it's due in EHB on April 30th, so 60 days after the end of after the halfway mark, and 60 days after the end of your project, so October 31st. The mid-year report will discuss activities from September 1st, 2017 to September 28th, 2018, and the end-of-year report will discuss the entire project period from September 1st, 2017 to October 31st, 2018. I'm just going to show you a couple of screenshots from the report. You may notice that it looks very similar to the quarterly reporting template. All right, so just a couple of notes on the report. So your total supplemental award means for all of your CAUs. So if my state has 2 CAUs, that's $90,000. The amount of the FY17 supplemental award spent at the end of the current budget period means the total amount of supplemental funds only that has been expended from September 1st to February 28th. All right. So this is the bottom part of the mid-year report. There are 4 questions on here. You'll notice that 3 of them are on your quarterly reports as well. The first one is, these are the data reports that you're going to submit to TASC for every hospital. Tracy Morton from TASC will be talking about those in just a few minutes. And then we would like you to provide a brief status update, just a really short sort of status, what has been completed from 9/1 to February 28th. Are there any challenges that may impact the completion of the work? And then explain project delays or other changes from the approved work plan. And then finally, discuss any budget issues from any participating cause impacting the work plan timeline or the ability to draw down related financial resources as planned. So if you notice in this report, we're looking specifically for information about the supplemental awards, so you don't need to include information from your regular flex activities or funds from your regular flex activities. We're just talking about the supplemental award. Okay, so we carefully weighed the need for data with the burden of additional requirements on both cost staff and state flex program staff, and of course we welcome feedback on better ways to measure success in the flex program. But the supplement's targeted approach offers us a really unique opportunity to better understand the impact of flex dollars. So we're collecting some data to quantify the impact of supplemental funds on individual cause and their communities, quantify the impact of supplemental funds nationwide, and use success stories from individual cause to build a compelling narrative about the less quantifiable impacts of these projects on individual cause, as well as the collective impact on all supplement grant recipients, supported by the quantitative evidence produced through these projects. Okay. Now, Tracy Morton from TASC will talk about the technical assistance available for the supplemental projects, as well as the impact evaluation.
Thanks, Christy. So the support that will be provided from TASC is to help the state flex programs not only gather that quantitative information, that the numbers of the outcomes of the projects that you're helping the hospitals deploy, but also some qualitative information as well too. So from TASC, we have planned some educational materials that are related to the supplemental project topics of quality improvement, financial and operational improvement, and then the projects related to substance use and abuse. We'll be providing some education to the state flex programs on using a method called the Recommendation Adoption Progress, and we'll be providing the states with that education through a teach-back method, which I'll explain here in a little bit. We'll also be supporting the data collection and reporting assistance for the state flex programs to gather the information, and then also to gather and roll up the information to support the Federal Office of Rural Health Policy in demonstrating the impact of this project. and then we'll be doing overall project assessment or evaluation of it in its entirety. So to explain those things a little bit further, so some of the educational content that we already support in TASC is related to quality improvement and financial and operational improvement. So whether that's in partnership with the Flex Monitoring Team or the Rural Quality Improvement Technical Assistance or our KETA group, some of those resources are already developed and supported or provided to each of the state Flex programs every year, and so we'll continue to do that. But we do have planned some special topic content to support the area of substance abuse, which is something that we haven't talked too much about in the Flex program in the past. So in May, we have planned to do a TASC 90 webinar for the State Flex program, specifically of substance abuse. Kind of a sister program, if you will, to the State Flex programs is a Small Rural Hospital Transitions Project. They do monthly webinars on helping rural hospitals, not just critical access hospitals, but rural hospitals transition to value-based healthcare. And they'll be planning to do a webinar on substance abuse too, which will be shared with the Flex program. I don't know the date on that yet, but when we do, we'll be sure to share that. We'll be expanding the resources, tools, and guides available on the center's website and on our resource library to support specifically substance abuse. And then we'll also be encouraging the use of the Rural Hospital Toolkit for transitioning to value-based systems that was developed by the Small Rural Hospital Transitions Project last year, which has in it a self-assessment for the hospitals to understand where they're at with entering into a value-based healthcare world. And it's absolutely relevant to every hospital, regardless of what type of project you're deploying within this supplement, to know where your hospital fits in with transition planning. And so we'll be using that as a marker of progress throughout the project as well. So I mentioned that we'll be supporting the State Flex programs with using something called the Recommendation Adoption Progress, or RAP. And if you've recently attended a Flex program workshop or been part of one of the State Flex program consultation projects, you've been part of a RAP interview already through TASC. But if you haven't, and you might have heard about this in the past when we did some evaluation workshops, but I'll refresh your memory about what this is. So RAP is an evaluation tool, and it captures the degree to which a program's activities have been implemented or its services have been utilized by the program participants. So we use RAP a lot with consultations when recommendations are provided to a facility or to a group, and then the RAP tool is used to assess later on the degree to which those recommendations or the activities were implemented by the facility or the organization. So the goal of the RAP is to demonstrate progress over time by indicating the extent to which a project or its recommendations have been implemented. RAP is a technique using appreciative inquiry. It's about a 30 or 40-minute interview with the hospital CEO and the project leadership team. And so we'll be training the State Flex programs through Teachback method to use the RAP method to ascertain your hospital's level of implementing its activities or its project. So the State Flex programs will be holding periodic RAP interviews with the hospitals. The interview will discuss their accomplishments, identify outcomes, and determine impacts of activities and services. It's an interview that's very much focused on the positive, not necessarily problem solving or discussing, focusing negatives, or we didn't implement anything yet, or kind of the nitpicking of things, but really focusing on what it is that you've done to date. It uses a 1 to 5 scale to rate the extent to which the hospital has implemented the project. And in that way, the RAP method is relatable from project to project, regardless of what the project topic might be, area, or the way that the activities are implemented. So it has a like scale then that can be used. So like I mentioned earlier, RAP uses appreciative inquiry, and it's looking at what is the best of what this project can be. What could this project be? What could we design it to be? How do we tweak what we have already going on to get to that desired state? And how do we, as a team that's working on this project, have individual actions that help us get to that state? So it's not necessarily a problem-solving model, but it's a way to encourage the interviewees to share their stories, focus on successes, and to motivate during that interview, that RAP interview, to kind of continue your engagement in the project and look at culture change that can help sustain outcomes. So we're really looking forward to working with the State Flex programs to learn about this method and to use it in these projects to kind of have a like way to evaluate the extent to which the projects are implemented, but also as a way that your program can use this technique in many other aspects, be it within Flex or SOAR or some other program, to evaluate the extent to which recommendations or actions or activities have been implemented in any of the activities that you're doing in your office. So some examples of some RAP questions might be, what's your hospital's current status with this project? What are your hospital's expected next steps towards implementing the project? And aside from measurable outcomes, what are some of the ways this project has impacted your hospital, its culture, and the community? So again, that kind of gets at some of those qualitative aspects that Christy was mentioning earlier. So TASC, like I said, will use teach-back method to train the State Flex programs on how to use RAP. So we'll be doing an overall webinar training for all the State Flex programs involved with the supplemental project. And then we'll be doing one-on-one coaching calls to each State Flex program, about 2 or 3 calls per state, to help you understand the RAP method, understand how to use it, how to be prepared to conduct that interview, kind of do a little bit of role playing, and to coach you along the way. So the State Flex programs then will conduct these individual hospital RAP interviews with each hospital in your state that's part of this project at both the 6-month period and at the 12-month period of the project. Additionally, at the end of this whole project, so the next year at this time, TASC will be conducting RAP interviews with a sample of hospitals at 15 months to kind of get at ultimate impact of what happened with these projects too. So with just a sample of those. And I should back up a second. With the RAP interviews, besides doing the webinar and the individual one-on-one coaching, we'll actually have a template tool, a worksheet for you to fill out while you're having the RAP interview that you can type the notes into and provide the score into and something. So a tool for you to use to conduct these interviews with as well. And they're very much just a phone conversation. The third thing that TASC will be supporting is data reporting. So the State Flex programs are going to be gathering information from their individual hospital participants and reporting all that individual hospital data to TASC. So we're working right now with the federal office to develop a data table that your hospitals will use to report in their data to it and then send to the State Flex program at certain intervals. The State Flex program then reviews that, makes sure it's complete, and then passes that data along directly to TASC. So we'll be kind of the repository for that and the roll-up center for all that information. Same thing with the RAP results. After the State Flex program completes the RAP interview on the worksheet that I mentioned before, you'll send along those individual RAP interview results to TASC as well. And TASC will review the data and the RAP results, provide feedback to you as needed about maybe how to improve them, to clarify information as needed, fill in the blank if something is missing, and those sorts of things as well. So here's a view of what the data reporting schedule looks like, and there is quite a bit of data reporting for this one-year project, but as Christy mentioned, it's an excellent opportunity to demonstrate direct impact of Flex-related funds at the hospital level. So this month, we'll be looking for State Flex programs to gather baseline information from their hospitals, as well as they have those hospitals complete that self-assessment for transition planning that I mentioned earlier. That's part of that transition toolkit, an online assessment that they complete. At the 6-month mark, so in March, the hospitals provide 6-month data in that data reporting table, and that's when the State Flex programs will conduct their RAP interviews. All that information will be sent to TASC. And then in April, that mid-year report that Christy mentioned earlier will be due from the State Flex programs into the Electronic Handbook, or EHB. At the 12-month mark, so at the end of the project period, again, the hospitals will submit data in a data table. The State Flex programs will complete individual hospital RAP interviews and send those all along to TASC. And once more, the hospitals will be asked to complete that self-assessment for transition planning, an online assessment tool. It provides a score out of 105 points, and so that's just a comparative mark that we can look to see from the beginning of the year baseline and at 12 months if the hospital is more prepared for transition planning too because of this project. Next October, so a little over a year from now, the State Flex programs then will be completing that final year-end report and submitting it into the Electronic Handbook. And then after that, at the 15-month mark, we'll be asking the State Flex programs again for help to gather 15 months data from their hospitals into that data table And then at that time, TASC will conduct a sample of RAP interviews with a sample of hospitals. As I mentioned too, the kind of the last component is TASC to provide some overall project assessment. So we'll be doing a return on community investment analysis for this project to understand the impact of this governmental investment into a community or communities across the country using a common base for comparison. So our OCI is based on an economic cost benefit analysis, and it measures the economic return or value to the community and constituents. It's a form of evaluation. It kind of lays on top of good evaluation, and it compares various outcomes across programs and projects in a method that takes aside the individual unique approaches that the different projects might have. And so what you'll see on the data table is that there are some hospital-specific metrics that each of your projects will be reporting on because they all have different projects that they've noted they want to do. And so we definitely want to hear what their measurable outcomes are for each of their project approaches. But because of the benefit of doing ROCI to have that economic return or value that we can say that's happened because of the federal dollar, we'll also be asking for some common metrics that every single hospital reports on related to finance and some related to quality, and if they're doing a project related to training, a specific training metric, and if they're doing a project related to substance abuse, a specific substance abuse metric. Like I mentioned, we're still finalizing that data table, so I don't want to totally speak out of turn until we're ready to roll that out, but do know that there will be some common metrics every hospital will be asked to report on, as well as their individual metrics that are relevant to their project and unique to them. So like I said, the assessment elements that will roll up into this ROCI analysis include all of the great data that you'll be gathering throughout this project, with hospital-specific data reports, that self-assessment for transition planning, kind of that pre and post score, the hospital RAP results. At the end of the project period, TASC will be conducting some individual site visits to a sample of the hospitals in the project. And in those site visits, we'll be looking to ascertain best practices, success stories, and lessons learned from the hospitals from their specific project as well. And so that just adds more color into the outcomes of this project besides just the things that we can count and specifically measure. And then, of course, on top of that will be an ROCI, so hopefully be able to demonstrate that for every $1 federal dollar invested, X dollars were returned to the community. So with that, I'll pause there. So Christy, we've got some time left. I don't know if we want to go into the specific timeline now, if we want to field questions, or what you'd like to do from here.
Let's go ahead and go through the timeline, and we can do questions at the end.
Okay, no problem. So the way that we organize this timeline is it's 3 rows that stretch very far to the right, but because our screen doesn't allow for that, they're separated onto 3 separate slides. And I realize the font is very small. If you look in the bottom left corner of your screen, there's a materials to download section. The first thing to download is the slide set here. And then the second thing to download is the supplement funding TASC timeline. So this is the timeline that's relevant for both the State Flex program, for TASC as a TA provider, and for the hospitals about what's happening in what month of this project, because there's a lot going on. Like I just explained, there's a lot to measure, a lot to count, and a lot of pieces to roll out technical support for too. So I'll briefly attempt to walk through these things, kind of a high level, but please do know that we're happy to answer any questions too about it. So this month will really be focused on both internal planning for TASC and FORHP, but then for the State Flex programs to communicate out project resources and expectations to the hospitals, and for the hospitals to complete that online self-assessment for transition planning and to submit their baseline data by the end of October. Later this week, if not early next week, we plan to provide, on behalf of FORHP, an email explaining to the state programs what the requirements are and expectations for the project, as well as a template email that you can use to communicate the information to your hospitals saying, this is what's happening with this project, this is the tool we'll be using to gather your data from, this is how to use the tool, and this is when it's due. So expect that information to come from us soon. In November, by November 3rd, we'd ask that all state flex programs submit the individual hospitals tracking documents, that measures table, to TASC by the beginning of the month, November 3rd. TASC will review that data and provide you with any feedback we see fit, like something's missing or whatever, within 2 weeks. And then by the middle of the month also, we'll be providing you from roll-up scores from that self-assessment for transition planning. So if you have more than one hospital working on this project in your state, we'll provide you with some roll-up scores about what it is that they scored with that online assessment too, so you're aware of where they're at. In December, that's when we'll start working on providing educational support to the state flex programs to conduct a RAP. So we'll be holding a webinar on how to do that and how to successfully communicate with your hospitals. And then we'll be looking for you to kind of reach out to your hospitals then at that point by the middle of the month and have a check-in call with them. How are they doing with the project? What's happening so far? Are there any barriers? And how can you help them manage the project effectively? In January and February is when TASC will be providing one-on-one RAP coaching calls with each of the state flex programs to get you prepared to conduct that 6-month RAP interview. And then in March, the state flex programs will be conducting the 6-month RAP interview with each of the hospitals participating in your state. And the hospitals will then be also completing the data table with updated 6-month metrics for the project. Kind of the same process as before. We ask that the state flex programs submit the data and the RAP interviews for 6 months to TASC by April 13th. And then within 2 weeks, TASC will look at that data, provide you any feedback, anything that's missing. Again, same sort of process there. And by the end of April, the state flex programs will be reporting their mid-year report into the electronic handbook. Into May, that's when we'll start looking with FORHP here at TASC to assess the project progress and identify any needs for TA support and reaching out to states that might be in need of help. So we'll be kind of reviewing all that information that's submitted year to date. And then in June, July, and August, we'll be doing one-on-one debrief calls with each of the state flex programs on how that first RAP interview went and how the projects are going so far and whatever TA support it is that we can provide, getting you ready to do the 12-month RAP interview that'll happen in September. So the states will complete that in September, and again, then the facilities, the hospitals, will complete their 12-month data table of the project outcomes and will once again complete that online assessment, self-assessment for transition planning by the end of September. We'd ask by about this time next year that each of the state flex programs then turn in that 12-month RAP and the 12-month data table for each hospital to TASC. And within a week, then we'll quickly review that data and get you any feedback. And then by the end of October, the states will need to submit their final year-end report into the electronic handbook. As we move into next fall and early winter, TASC will start to do some site visits with a selection of hospitals, again looking for outcomes, best practices, and lessons learned in some of that qualitative data. And from those hospital visits, we'll develop one-page spotlight reports, similar to what we've done in the past with the critical access hospital recognition spotlights or awardees, if you're familiar with that. And then in December, TASC, so this is December of 2018, TASC will be doing final RAP 15-month interviews with a selection of some of the hospitals to find more additional outcomes. And we're providing a webinar to the state flex programs about the results and successes identified to date. In January 2019, which seems like an awful long time from now, we'll be asking one more time for the states to reach out to the hospitals that participate in this project and to gather that final post-project 15-month data into that data table and turn that into TASC by the early part of January. Again, TASC will review that, let you know if there's anything missing or we need some clarification on. And that's then at the point where TASC will turn all of this data over to a subject matter expert who is going to be doing the ROCI analysis. So he'll be working on that through the spring and early summer, and we'll look to finalize that report with FORHP by about 2 years from now, which seems pretty wild. So that is the entirety of the project timeline. And so I'll turn things back over to you now, Christy.
Thank you, Tracy. All right, so I think we're ready to take questions. Star 2 to unmute your line, or you can type the question in the chat box.
Looks like a couple people are typing, but again, if you want to just ask your question, you can press star 2. So it looks like Christy, Joyce in Arizona is wondering which states are working on substance abuse. Is there going to be a listing out of which states are doing what kind of projects, or which hospitals are specifically doing what kind of projects?
Yes, that's not a list we can finalize just yet because we're still working on ironing out all the details for projects, but we'll certainly share that information with you. We know that several of you, especially those working on substance abuse, are eager to work with some of your other state flex coordinators to work on what is a really brand new project for us.
Mm-hmm.
So the next thing, can you repost the link to the report template or add as a material? All of the materials and templates will be emailed out to you shortly.
Mm-hmm. And we will, the next question down, where on the TASC website can we find the tools and such? We're clearly in development of these things right now, but on the TASC website, there is a spot where the Flex Grant guidance is, and it will all be housed there kind of in a unique area together, so we will be sure to communicate that out, not only with just the direct files that we'll email to you, but also where you can find the stuff on the website in the future as well.
Hi, Brenna. What state are you in?
That's Arizona.
Brenna's Arizona.
Okay, so concern about the evaluation burden based on what you wrote in the proposal. If you do feel the need to adjust your proposal once you see all of the templates and get a sense for how much time that's going to take, you can certainly talk to your project officer about it and see if there's some things that you can do to reduce the burden.
And Brenna, this is Sarah. Christy, Omi, and I are all three in conversation about these projects, so you don't need to worry that he's out of the loop either.
this is Tracy, just to add my kind of 2 cents here. The overall evaluation metrics that we'll be asking for on that data report at baseline 6 months, 12 months, and 15 months, the overall metrics that they're reporting outside of kind of their project-specific ones are pretty generic metrics. They're things like days cash on hand and operating or margin and things like that. So they're not something that the hospital doesn't have ready access to. So if that helps alleviate any concerns about those kind of extra metrics that we'll be asking for, they should be things that are well within their reach to easily get at.
Many of the other metrics that we're asking for are also ones that you guys submitted as a part of your work plans. All of you were asked to submit program measures with targets, with baselines and targets, and we're going to take those and put them into a reporting template so that everybody is reporting the same way.
And that's the same thing that Christy referred to earlier as your hospital-specific measures, because we both want measures that are specific to each project and appropriate to each project, and then a couple of those cross-cutting measures, as Tracy said, days cash on hand, and really standard measures that everyone has, so we can do big picture comparisons.
Yes, Joyce, substance abuse is going to be a little tricky. We've been going back and forth about metrics for substance abuse for quite a while now. But once we have a sense of what all the projects are, I think we'll be able to make some decisions. But again, almost all the metrics in there are going to be ones that are in your work plans. Not all of them are going to be defined by us. Only a few are.
Are there other questions or concerns about how the RAP process will work?
Or questions related to any other content?
Thank you, Joyce. We're all looking forward to the process. This is really, this is a rigorous evaluation. We're really trying to do that and take advantage of this supplemental funding as an opportunity to show what we can do with Inflex and what you all can do working with critical access hospitals in particularly vulnerable communities. Because remember, the hospital selection criteria for this was that these are in counties, these hospitals are serving counties with high rates of poverty and unemployment, and also had to be in states that had high rates of drug overdose deaths. So these are communities with a lot of health challenges, and it's going to be a challenge for us, but also a real opportunity to do a rigorous evaluation and show how we can both individually and with all 40 CAUs collectively improve the situation for people in those rural communities. Exactly. Both. Yes, Joyce, we want to make sure the metrics are narrowly defined and clearly defined so everyone understands what they're measuring and what they're reporting. Thank you for asking good questions. Are there any others?